White House and their allies in Congress are set to ram through possibly the worst government takeover of our lives, and they could act any day. If passed, not only could Obamacare's trillion-dollar price tag be the last straw to bankrupt our country, but it would also hand control of our healthcare industry to unelected federal bureaucrats who will decide who gets medical care and who doesn't. Ultimately destroy private health insurance by herding hard-working Americans into a government-run health insurance boondoggle. Dramatically raise taxes by counting health benefits as income, or by forcing businesses and uninsured workers to pay for officially sanctioned Fannie Mae insurance, and allow for even more government intrusion into our personal lives by paving the way for bureaucrats to tell us what we can and can't eat, drink, and smoke, like New York City's ban on smoking and fats in food. As scary as all that is, big government politicians in Washington think they need to act now to have their best chance to ram this through. Chances are they won't have better luck after November, so these next few weeks are critical. We all saw another recent example of how the government deals with healthcare with their radically overhyped threat from the swine flu. Combine their ability to manufacture fear with the legitimate worry people have about losing their jobs and their health insurance due to the Fed-created recession. Well, it's no wonder they now believe the American people will not stand up again to their schemes. But of course, you and I both know the answer to our problems is not more government involvement in healthcare. The answer is less, so the free market can inexpensively and efficiently distribute much-needed healthcare services to all American citizens. But of course, that's not what those in power in Washington, D.C. really want. After all, that would mean they'd have less power and less control over our lives. And power and control are exactly what this fight is all about. You see, this government healthcare takeover and rationing scheme strikes at the heart of everything you and I hold dear. You and I believe American citizens are not cattle to be poked, prodded, and herded like livestock by government bureaucrats. But under their big government healthcare power grab, you'll be nothing more than a dehumanized statistic, a number on a piece of paper. So those federal bureaucrats won't be making their decisions on what healthcare you and your family receive based on what you and your doctor decide is best. They will decide what's best for you. But isn't your life really worth saving? Your family's too? Well, the big government politicians in both parties don't think you should make those decisions, or your doctors. Instead, they want their own hand-picked Washington, D.C. bureaucrats to make them for you. And if you don't like their decisions, well, hopefully you can live with them. Literally. Now, what do you think will happen under this system if your political or religious views happen to be, quote, undesirable? What about if you own a gun? Well, after seeing all those government memos accusing patriotic citizens of being terrorists, I, for one, don't want to find out. After all, just what the big government politicians admit is bad enough. They say they want a socialized healthcare system like Canada's. There, folks have to wait over 4 months just to see a specialist, and over 6 months for a simple surgical procedure. Can you imagine that? Is that really what we want for ourselves and our families? Well, Ron Paul and Campaign for Liberty strongly say no. The good news is Campaign for Liberty has already helped lead the fight, and we have a plan to fight back again right now. But I'm counting on you to help today. First, we're starting with petitions, which I hope you'll agree to sign today. We're gathering them now and will deliver them in the coming days. Next comes email blasts, blogs, direct mail, phone banking. And don't forget about meetups, leaflet drops, media and PR blitzes from Campaign for Liberty staff, members, and supporters. Finally, if we can raise the funds, hard-hitting newspaper, radio, and television ads. But such an expensive program isn't cheap. So in addition to agreeing to sign those petitions I told you about, will you agree to make a generous contribution to Campaign for Liberty? The truth is, without your immediate action, I'm afraid there just won't be enough time or money to do everything that needs to be done. Campaign for Liberty has no big multinationals or billionaires to pay for our programs. I'm glad we don't, so we aren't beholden to anyone else's agenda. But that means every time we take on a